Hello, my name is Dr. Diwan S. Raja. Today I will discuss about ulnar canal syndrome, also called Guyon Canal syndrome. Ulnar canal syndrome or Guyon Canal syndrome, also known as handlebar palsy, because this condition results from compression of the ulnar nerve as it passes through the ulnar canal, also called Guyon's canal, in the wrist on the medial aspect of the wrist on the medial and anterior aspect of the wrist. This is an entrapment neuropathy. Anatomy of the ulnar canal, location at the wrist between the pisiform and the hook of the hamate. These two are carpal bones. The depression between these bones is converted by the piezohamate ligament into an osteofibrous tunnel, the ulnar canal or Guyon canal. Content of the Guyon canal or ulnar canal is ulnar nerve, ulnar artery, and ulnar vein. Okay, so this is the pisiform bone and the hook of the hamate bone. We have the ulnar canal is located here. Above it is covered by the transverse carpal ligament. Okay, and it is going, transverse carpal ligament is same as the flexor retinaculum, so it goes through the superficial layer of the transverse carpal ligament, and it is covered partly by the hypothenar muscle like palmaris brevis, and it is in relationship to that of the piezohamate ligament. We have the ulnar nerve, the deep branch is turning around that, and it supplies the interossei muscle and the adductor pollicis muscle. The superficial branch is cutaneous. It goes to the first, the fifth or little finger skin on the palmar surface, and the medial half of the skin of the ring finger. We have the dorsal branch that pick up sensation from the dorsal aspect of the fourth and fifth fingers. So in case of ulnar ulnar canal syndrome, the posterior aspect of the fifth and fourth digit or finger skin sensation is not hampered. It is the palmar surface that is affected. And depending on the site of injury, the presentation and the damage and there is lesion to the nerve supply of the muscle also varies. Okay, the superficial branch is this, and if it is damaged here then we'll get both deep branch which supplies the muscles as well as the skin cutaneous sensation, both may be affected. There is lesion there. If there is lesion there, this is intact sensation from the palmar aspect of the fifth and fourth digit will not be a problem. Just the muscular innervation by the deep branch will be lost. So it is the site of lesion that will determine what would be the clinical manifestation. So what are the causes? Prolonged pressure on the wrist from cycling, handlebar palsy, ganglion cyst, repetitive trauma, fracture of hamate or pisiform, occupational tool, jackhammer use, tumor, arthritis, vascular anomalies. So these are the possible causes of ulnar canal syndrome or Guyon canal syndrome. So clinical feature, as we discussed, site of injury, whether it is only the superficial branch of the ulnar nerve is gone or the deep branch of the ulnar nerve is affected, and where it is affected. Depending on the situation, we will have different type of clinical presentation. Typical findings: sensory loss over medial 1.5 finger, palmar side, not the dorsal side. Hypothenor eminence area also will lose. There's chance of losing the sensory function over the hypothenor eminence skin. Motor weakness of the hypothenar muscle, abductor digiti minimi, flexor digiti minimi brevis, opponens digiti minimi, clawing of the hand of the fourth and fifth finger, interosseous function will decrease, finger abduction, adduction, abduction with dorsal interosseous, adduction by the palmar interosseous. Third and fourth lumbrical, decrease metacarpophalangeal flexion and interphalangeal extension of the ring and little fingers. Adductor pollicis, decreased thumb adduction, formant sign. So these are the typical findings in case of ulnar syndrome or Guyon canal syndrome. Diagnosis, clinical examination, tinal sign, just tapping on the Guyon canal, we can get tingling numbness, 1.5 finger, tapping here. So it should be tapped on the Guyon canal. Nerve conduction studies, electromyography, okay. MRI, ultrasound to assess for masses or structural lesion. Differential diagnosis, cubital tunnel syndrome, ulnar nerve compression at elbow in its passage through the flexor carpi ulnaris, included dorsal hand sensory loss, ventral side of the ulnar distribution 1.5, both dorsal and ventral both are lost, and all the muscles supplied by the ulnar nerve will be lost, including the flexor carpi ulnaris and also flexor digitorum profundus to the ring and little finger. So what is the treatment or management? Conservative activity modification, like avoiding some type of hammer or over bicycling, wrist splinting, NSAIDs, non-steroidal anti-inflammatory drug like ibuprofen. Surgical management, decompression. If conservative management fails or a space occupying lesion is found, we need surgical intervention to release the ulnar nerve at the Guyon canal. And that's all about the ulnar canal or Guyon canal syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.